This Good to Go segment is sponsored by Spectrum Health Medical Group.
September is Vascular Health Awareness Month, and protecting your vascular or circulatory system is critical to so much about a person's overall health. Dr. Ashraf Mansour is a vascular surgeon with Spectrum Health. He's here to talk about this network of vessels that carries blood and oxygen throughout the body. Hi, Dr. Mansour.
Hello, thank you for having me.
Do I describe the vascular system appropriately, and why is it so important to our overall health?
Well, as you mentioned, the circulatory system is basically delivering oxygen to all the tissues around the body. So we have arteries that leave the heart and go to the rest of the body, and veins that bring the blood back to the lungs so they can get oxygenated and then send oxygen and nutrients to all parts of the body. So it's really an important system to take care of.
Let's talk about the pandemic for a moment, because it has impacted so much about our lives. I imagine that the vascular health of people has been impacted by COVID.
Absolutely. So as you know, COVID is one of those viruses that affects a lot of systems. It does come in through the respiratory system, but it does affect a lot of organs in the body, including the vascular system. For example, we find that a lot of sick patients with COVID can develop blood clots in different areas of the body, from the brain all the way down to the legs. And some of these blood clots and some of these issues can be life-threatening, as you well know. We've had several sick patients come through our service and through Spectrum, and it is really heartbreaking to see the devastating effects of this virus.
So in the treatment of the COVID, there has to be the addressing of those blood clots. What do you do about those?
Yes, so you're absolutely right. When somebody is at a risk of developing blood clots for whatever reason, for example, we know that some operations can predispose a patient to have a blood clots. So we do something called prophylaxis. So we give somebody a blood thinner ahead of time to help the blood circulate and stop stagnating and causing blood clots, because the stagnation of the blood is one of the reasons for blood clotting abnormally.
So that leads me to ask you about maintaining the health of our vascular system. What is it that we should be doing to stay healthy in that regard?
For the vascular system in particular, there are certain things that you can't change. So your genes, you can't change that. You inherit your genes from your parents or your grandparents. You're not going to be able to change that. But certainly a good diet, a proper diet, which is low in fat and low in things that have high cholesterol, is a good thing. Avoiding smoking, exercising on a regular basis, making sure that your blood pressure is under good control, making sure that your cholesterol is under good control. These are all things that are really very important to maintain a healthy circulatory system.
I imagine that spider veins and varicose veins are one of the most common things that patients come to see you about. Is that true?
That is true. So we have a vein office where we concentrate on patients who have vein issues. And these can be a whole bunch of a whole range of issues, from blood clots to spider veins and anything in between. And thankfully, spider veins and varicose veins, most of the time, is not a life or limb-threatening situation. So it can be treated with success, and most of the treatments are done outpatient, and the results are very good. So we have a whole bunch of different things that we can do to help people. And, we have a lot of options, and we ask the patients to help us decide which ones are good for them.
Well, important information during this Vascular Health Awareness Month. And we want to let you know that Spectrum Health Vein Center will be hosting a free screening event on Thursday, September 23rd. If you can't make that event, call the Vein Center to schedule a consultation or visit the Vein Center website. You can find all of this information at 13onyourside.com. Dr. Mansour, thank you.
Thank you so much. Have a good day.